The following portion of Daytime Tri-Cities is sponsored by Douthat Insurance.
Well, when it comes to health insurance, Medicare and Medicaid, there are often many questions and information. It can be overwhelming to navigate. Our friends at Douthat Insurance have been answering those questions for several years, leading people through the process to help them make the best choices. We want to welcome back to the show Margaret Douthat, and it's great to have you.
Oh, thank you. Very nice to be here. Appreciate that.
I think there's obviously, we're kind of in the year now, open enrollment over, but you said a lot of people on an individual basis will still be answering these questions.
Exactly. So individuals that maybe are choosing to retire, this is a time of year a lot of people choose to retire, but they're not Medicare eligible. And so there are individual policies. Even saying individual will confuse people sometimes because sometimes you're bringing your whole family. But they're individual policies, and we certainly can help individuals with that. It is called Affordable Care Act, although some people will say Obamacare or Marketplace or healthcare.gov. They all mean the same thing, and learning how to navigate that and what determines your eligibility. So a lot of people think they can't get insurance if they have a pre-existing condition or something. That is not a worry at all. So if there's a need, if you're retiring, if you're moving into the area and you're needing individual insurance because you don't have that through Medicare, Medicaid, or through the employer, then we'd be tickled to death to help you and kind of walk you through that.
And Margaret, you said even though we're in the actual year now, people are still getting those phone calls, which can be scams and scary and make you question what you're doing.
Yes. So many people that are enrolled in Medicare, continually get a lot of phone calls, text messages, emails, etc. So one thing, during open enrollment, you can make those changes, but outside of that, you really can't. But a lot of times people will allude to the fact that, oh, there's been changes and we need to help you get into the right plan, etc. One of the areas where that is possible is if you actually have a chronic health condition, and it does have to be a certain condition, so not just anything chronic. So some companies have developed plans to help people on Medicare if they're experiencing chronic health conditions that possibly could be a better benefit. So I encourage everyone that receives calls or something to that effect, contact their local agent. If you don't have a local agent, of course, we'd be happy to help, but contact a local agent, let them guide you through rather than getting kind of duped into something that really isn't for you, and then you lose everything, and that happens.
And that's scary. And they're really good.
They're
unfortunately
very good
at what they're doing.
Yes, unfortunately, they know exactly how to maneuver the questions to get someone to kind of take the bait.
Yep. And then the prescription part of it, if you're paying a lot for prescriptions out of pocket.
Yes, so this year, for those that are on Medicare, individuals actually received a little bit of help. It might not feel like that sometimes, but last year, if you were on Medicare and you were receiving medications, you could potentially pay up to $8,000 out of your own back pocket. This year, that's been reduced to $2,000. So there's a lot of rules that wrap around that. One, your medication has to be something that company would cover. So if you're enrolled with a certain insurance company, they need to cover that medication. You also need to receive that medication with a pharmacy that your insurance company works with. So sometimes people will walk in and say, oh gosh, that's a lot of money. Maybe they have a deductible and they don't want to pay that. And the pharmacist, meaning well, will say, well, we can sell it to you for $100 cheaper. You're losing just that opportunity to hit your $2,000 quicker and then not pay anything. And there is government assistance. So sometimes people with a lower income and a lot of assets can apply for that as well. And that reduces their cost drastically.
Okay, so a lot of information. I can see why it is so valuable to have someone like you who can navigate, who understands the different plans. If you would like to get in touch with Margaret or David Douthat, you can do so. It's Douthat Insurance. It's right there on South Wilcox Drive in Kingsport. For more information as well, you can always check out their website. Margaret, thanks so much for being with us.
Thank you. Appreciate it.
The preceding portion of Daytime Tri-Cities was sponsored by Douthat Insurance.